This original WSRE presentation is made possible by viewers like you. Thank you.
Politics, healthcare, and Fidel Castro. Former House Majority Leader Jerry Maygarden on this edition of Conversations. I'm Jeff Weeks. Thank you so very much for deciding to spend some time with us, and welcome into Conversations. Jerry Maygarden, welcome to our program.
Well, it's good to be here. Thank you for your invitation.
You have spent a good portion of your professional life in politics and or healthcare, and it seems the two of them are on a collision course as we speak here. What are your initial thoughts of what's going on with the big move in Washington on healthcare reform?
Well, it's a hugely complex issue, and the thought of trying to resolve it with a single comprehensive bill, even a universal health plan of some sort, really is a bit, I think, delusional. It's a problem that has a lot of components to it. It needs to be dissected completely and dealt with according to national goals and national strategies. And quite honestly, I don't think the Congress has done that. And they're putting together a package. They're trying to force something through that it ultimately is going to be terribly expensive, and it's not going to be good for either access or quality. I hope they stop and take a breath.
The president has said he wants to make this thing budget neutral. I mean, is that possible?
It's not. The truth of the matter is, the complexity of healthcare is a three-legged table, a three-sided table, with a pedestal in the middle. The three sides are access, quality, and cost. And if you lean on any one of those, you tilt the whole thing over. If you expand access, which is really what the president hopes to accomplish, you drive up cost. Mm-hmm. If you drive up cost, you have less resources available to deal with quality. If you try to improve quality, here again you drive up cost. So any place you touch this problem, it's going to cost more money. It's going to cost a great deal more money. So the whole notion of we're going to fix this and have it budget neutral and have it cost less is really, I think, a bit of a pipe dream.
Which brings me to the question, we say fix, and we've heard that term tossed around. Is the healthcare system genuinely broken?
Well, you know, it's kind of funny. There's a dichotomy of interest here. You ask the average individual, what do you think about your healthcare system? And they'll all say, don't mess with my health care plan. Mm-hmm. Then you say to people, well, what do you think about reform, fixing health care? There are 45 million people without health care. It's terribly expensive. Oh yeah, absolutely. We need to fix it. It's sort of one of those things where mine's pretty good, don't mess with it, but I don't mind fixing it for someone else. The dilemma is I don't think there is a single comprehensive fix in health care. There's a need for our nation to look seriously at how we deliver primary care, how we provide care for every individual who needs access, needs a medical home, who needs preventive care, who needs coaching in nutrition and exercise, a person who needs inoculations, whether it's for the swine flu or for ongoing maladies that crop up in the population. Then there's this whole notion of tertiary care. How do we provide major care for people who have serious diseases and serious accidents and major catastrophes in their life? And then there's population-based care, meaning how do we deal with children? How do we deal with the frail elders? How do we deal with all the people in between? And it's hard for to think of any group of people creating a system that wraps its arms around all of that, and certainly without it costing anything more. So I really think they need to step back and say, okay, what is our national priority with health care? And how can we dissect this big industry we call medicine and begin to put in place goals and objectives that accomplish those national priorities? It's easy to say, yeah, we want everybody to have health care, and yeah, we want everybody to have cheap health care. Right. It's just not practical.
Is it, I've heard different stories about this, that maybe truly there are not as many uninsured folks out there as some folks would claim. or those that are uninsured are that way because they choose to be? It's the young college kid who says, well, I'm just not going to pay the premiums, I'll take my chances. Is that legitimate?
Well, I think there is some legitimacy to it. A couple of years ago, William Bennett actually made a shot at dissecting that 45 million people, and he came down to about probably 11 or 12 who were genuinely without insurance and had no way of accessing the insurance market. But there were a lot of people who were in between jobs, people who had made a conscious decision to forego an insurance plan that was available to them. And in some cases, there were people who just didn't want to be a part of an insurance program, period. So it probably is really a much smaller number, although 10 or 12 million people, still a lot of people.
Yeah, sure.
And there has to be some way for those people to access the healthcare system at a reasonable rate. Part of the problem is they're getting their health care today, but it's in the emergency rooms of many of our hospitals. And that is the highest price delivery mechanism available, the emergency room. It should be designed for true emergencies, not the person who's going there simply because they don't have anywhere else to go. It's a very complex, difficult issue. A lot of it's driven by what is our social desire, what is our social need. We'd like for everybody to have health care, but quite honestly, there are a lot of people in our country today who can afford health care, and do we want to impede a free market for the acquisition of health care? How many people do we really want to take care of? I think I had a young man several years ago when I was in the legislature stop me in the parking lot at what used to be Albertsons, and he said to me, "Why is it that I have to give up a portion of my paycheck so that my father can have free health care? He's 65 years old and has a lot more money than I do, has quite a bit more money than I do." And when you think about providing on a social level care for people simply because they reach the age of 65, it is a little bit ludicrous when you have a social program like that. Do we want to buy Donald Trump's open heart surgery?
Yeah.
So maybe we ought to back up and take a look at these programs and say, what do we really need as a nation to make us healthy and whole? How do we manage disease? There are 5 or 6 broad categories of disease that if those good folks in dealing with their malady were registered as part of a disease management clinic and they were pursued aggressively. I'll give you an example, diabetes. It's a big problem in Escambia County. It's a huge problem across the country. If people with diabetes were enrolled in a clinic that helped them get their medications, that advised them properly on nutrition and exercise and how to care for themselves, we would dramatically reduce the morbidity associated with diabetes and therefore drive down the cost of health care significantly. I think those people should be treated. I think there's a role there for the government, and we should lift them up out of the insurance pool, thereby reducing the risk to the insurer, and the rest of us who are out here trying to buy insurance would have a much lower premium.
Now, you've been in politics for many years on numerous levels. Why do you think that politicians, particularly in Washington, do not seem to have an appetite for pushing preventive care? Seems to me, anecdotally speaking, that it seems to be more, let's throw money at it and just try to solve the problem, as opposed to let's prevent an issue from occurring. Why is that?
Well, so much of prevention requires individual initiative, individual motivation. And it's one of those things that's hard to legislate. You can't make it against the law because you don't exercise. It's one of those things that's terribly difficult to fund. We can measure disease. We have some knowledge of what the impact of a disease is, how it progresses over time, and what it takes to perhaps cure that disease or treat that disease. But it's kind of hard to measure wellness. You're well today, therefore how do I pay you to stay well? What probably, if there's a role in that for government, I've thought a number of times it may make sense for us to have community clinics that are so many community clinics per, say, 50,000 people, or 100,000 people that are medical homes for people that we can enroll our people in and perhaps give them a sound, ongoing connection with the healthcare system. They get their inoculations, they get treated for their minor ailments, they get their diagnostic port of entry into the system. Maybe there's something like that would be a good role for the government to play, but financing all of healthcare, I just don't think they're going to be able to do that.
What about the way medical professionals are compensated? There's been a lot of talk about that, and the president has used the Cleveland Clinic and the Mayo Clinic and the fact that the professionals there, the doctors, are on salary as opposed to a fee for service. Is that a legitimate argument?
Well, I think the most important thing when you're dealing with compensation is that we align compensation of physicians or caregivers, not just physicians, but all caregivers. Align it with outcomes. We should basically reward people who are extremely good at doing what they do effectively and efficiently. And I think that's important. So much of healthcare today is reimbursed on formulaic systems. Medicare, for example, is based on DRGs. The government says we're going to pay you so much for a diagnostic-related grouping, regardless of whether it takes 2 days to cure it or 5 days to cure it. Those formulas, while they may be able to control cost with it, they're certainly not doing access and quality a favor. I think the important thing is that compensation be aligned with outcomes as opposed to work in progress or showing up or being on the job.
Right. It's sort of like the real world where success breeds more success.
Absolutely.
So to speak.
If I'm really a good at curing pneumonia, and I have put together the best of practice in taking care of pneumonia, and I can get a person in and out of the hospital in short order as opposed to somebody who might labor there for 9 or 10 days, I should probably be compensated at a different level from those who waste our time and money.
What about, too, from an administrative standpoint? We hear, talk about, medical records being electronic, and, I know from personal experience, it's a convoluted experience, it seems like, as far as billing and stuff, and not just for the patient, but for the doctors as well. How can we change that?
Well, that's an interesting phenomenon because a lot of the technology is available. The barcodes and tracking medications and all those kind of things. It's out there, but most hospitals, most caregivers have insisted on putting their dollars at bedside and not into that kind of administrative technology. Plus, a large part of the industry is like a cottage industry. These doctors don't work for the hospital. Many of them don't. Therefore, they're out there on their own, and they're not really connected as well as they could be. There are a lot of companies out there who are working on overcoming that, and I think one of the things that the president has done, which I think is a good one, is begin to insist that hospitals look at that administrative technology for helping to track patients, keep their records, put some uniformity into that process. Makes a lot of sense.
As this continues to be a big focus for our country, put on your political prognostication hat for a second. What do you think will ultimately come out of it this round?
I don't think any of us truly believe it's going to be cheaper. And you just look at the numbers that come out of the Congressional Budget Office. The most recent round was medications, pharmaceuticals. Right. They were going to implement a program at X billion a year, and it turned out to be Y times 2 billion a year. We always seem to miss on these numbers, and so I don't think the public really trusts what they're doing. There's no confidence that they have a handle on it. I know when I listen to the debate on television among politicians, I'm wishing I was sitting there listening to the brightest minds in medicine, not the brightest minds in politics. And I think we have somehow already come between the medical community and the citizenry with our laws. And we need to step back and rethink how we're doing that.
Speaking of politicians, do you get the sense that we are sending the best and the brightest to either Tallahassee or to Washington?
Well, certainly when I went over there, the best and the brightest went over there. But no, I don't, and I'll tell you why. And it's a rare instance when you have the wherewithal, the financial resources, and the home support to go over there and give as much energy and time to public service as it takes. And a lot of the best and brightest minds in America today are not going to sacrifice what they're doing to be a part of that process. It's unfortunate, but I've talked to a lot of great people with ideas that just exude good ideas about how to make things better. They wouldn't think for a moment about running for office. One of the things I learned early on, you've got to have a very forgiving employer or be independently wealthy.
Right.
And you've got to have a very forgiving family or like living alone. One of the two. And it's hard to find people who are willing to make that kind of sacrifice. So quite often what we do is we wind up getting people who are looking for a job, looking for something to do. They're not by any stretch of the imagination dumb people. Right. They're very bright people, but they've chosen a path. I think that they haven't really demonstrated any success before they get there. Right. And perhaps I'm being overly critical, but many of my colleagues, when I was in the legislature, had not really had successful careers, and then they fell into politics and found themselves really operating or running a $60+ billion corporation we call the state without the skills necessary, I think, to do that.
Speaking of your career in politics, you've written a book called Inside the Bubble. What's the crux of the book about?
Well, Inside the Bubble was a collection of essays. When I was in the legislature, I was the majority leader, and the majority leader in the House of Representatives has responsibility for crafting the majority party's opinion on all the issues. And our office worked on that. We did a lot of analysis work. We did a lot of position papers. And I came away from there with changed attitudes and views about many issues. Came home after I left the legislature, and for 2 years I wrote a column for the News Journal, and most of those were based on many of the positions we had developed in the legislature. Inside the Bubble is a collection of those essays. There was a place on the floor of the House of Representatives in the back. It was a glass room. And whenever there was a problem between members, the Speaker would frequently say, Mr. Weeks, why don't you get with the majority leader in the bubble, and you guys work this out, and we'll take it back up once you've worked out a solution. So I spent a lot of time inside the bubble, and so that's kind of where the handle of the book comes from.
What was the most fascinating thing that happened to you in your political career?
Most fascinating thing? Well, I was always bowled over by the fact that what used to be a skinny kid from Brownsville in Pensacola could find his way to really a seat of great authority. I had an opportunity to manage a horrendously large budget. I met with presidents. I had an opportunity to dine with governors. It was a tremendous learning experience for me. But I think one of the most telling stories my wife tells. She said, "I know you think you're really a big shot in politics, but I want you to know when I go to the grocery store and write out a check, I still have to tell them how to spell your name." So it's always a little bit of an awakening to find out how far you can get away from the average citizen by pursuing that path. And it was always a good reminder that I needed to get back home and deal with constituents, knock on doors, listen to their needs, listen to their concerns, and the sheer majesty of our democratic system is extraordinary. We are very critical of a system that is, without a doubt, and I've been to a lot of other countries, without a doubt the best in the world, and we should be very proud that we have it and do everything we can to keep from running it in the ground.
We complain, but it's still the best by far.
Oh, by far.
Speaking of other countries, you had a chance to spend some time with Fidel Castro. What was that about?
Well, it was interesting. The time it was in 2002. I'd been asked by the city of Pensacola to represent them in Cuba. I was a former mayor, legislator. At the time, the embargo is still on with Cuba, but at the time there had been a lifting of the embargo for humanitarian purposes. There had been a number of hurricanes that hit Cuba, and we were shipping goods down there, but you had to make application to be a port of debarkation for goods going to Cuba, and the only way you can make that application is to go down there and do it. City manager asked me if I would go lead a delegation down there to make application to be a port of debarkation for goods headed to Cuba. We went down and we met with all the officials. I had an opportunity to actually do some things I wanted to do. They asked me, what would you like to see? I said, I'd like to see your hospital. And I got a tour of the hospital there in Havana. I said, I'd like to see Ernest Hemingway's home. And on the fourth day, we were kind of waiting to catch the ride out to see Ernest Hemingway's home in Cuba. And we get a call from the administrative people in Fidel Castro's office asking us to come to lunch. We went to lunch, and that lunch lasted from about 11:30 in the morning to 6 o'clock at night. In fact, we missed our afternoon flight out of Cuba and had to catch a much later flight at 9 o'clock to leave the island. It's quite an experience. I don't have anything in common with the man. His politics are absolutely the worst. In many eyes, he is Darth Vader in drab olive. The interesting thing was to dialogue with a guy who was probably the last Cold Warrior left. Nikita Khrushchev's gone. John F. Kennedy is gone. And Castro is still there, and Castro is still very visible in the minds of Floridians. It was interesting having a dialogue with him. We jousted back and forth. He basically told me what a great job he had done providing literacy to the island of Cuba. I explained to him that one of our early founders, revolutionary heroes, Thomas Jefferson, felt like a country could not remain ignorant and free. He said, Jose Marti said that, the great Cuban revolutionary, as though I had snatched a quote away from a Cuban leader. And I said, well, Marti must have read Jefferson. And he broke into laughter. He'd been speaking in Spanish, but he understood exactly.
He understood that.
He understood exactly what I said.
Do you think there's any real benefit for us, the U.S., to lift the embargo?
Well, I do. I'm one of those. I've been criticized for saying this, but I don't think the embargo has worked at all. The people who've paid the greatest price for the embargo really might be here in America. We've given up 11 million person market 90 miles from our doorstep in order to press a point. The people, the commoners of Cuba, are living at really substandard conditions. As a nation, I think we would be far better off to make it so that people could go there, to make that island awash in American dollars. If nothing else, make them dependent on our economy. The truth of the matter is 50 years worth of embargo has not produced the result that we had hoped. Castro will die someday, probably soon. He's getting quite old, and they'll say, see, it worked. But the truth of the matter is it really has not paid big dividends for us as a people or a nation.
Let's shift gears back home for a second. You're executive director of Better Pensacola Forum. I know you guys just recently did a survey. What did the survey tell you about the folks who are living here?
Well, this year's theme, this is the second year we've done the Quality of Life survey. This year's theme was clearly the economy. I mean, everybody's feeling the pressure of a bad, weak economy. Last year when we did the survey, it was the end of July, and people were sensing a bad economy. But we really didn't hit the brick wall until about October. We took the survey this year in the latter part of July. 800 plus citizens were surveyed, and they were really embroiled in concerns about job security. Is this a good place to live at such a bad time? Will we have good paying jobs, quality jobs available? And it affected almost every question that we asked. So the theme was truly the economy. And I would dare say we could have taken that survey instrument and gone across the border into Baldwin County or gone to our east to Leon County and Tallahassee, and the results would have been very much the same because of the economy that the nation's in today.
We have roughly 3 minutes or so left here. The argument here in Pensacola is that we look to the east, and Okaloosa County, Walton County in particular, has done a great job in developing their economy. Baldwin County, Mobile counties to the west, and I've heard so many people say, what's wrong with us? So what's wrong with us?
Yeah, well, actually, nothing's wrong with us. Pensacola's a great place to live. Escambia County is a good place to live. You know, you have to kind of look at what these other places have going for it. One thing is, over to our east, a lot of those lands have not been built out or developed already. So growth is possible, and that potential is there. There's a huge military industrial complex over at Eglin that attracts a lot of business and industry in that regard. The things that are going on in Baldwin and Mobile counties, quite honestly, the problem is our state regulatory environment. It's a very stringent state in order to place a business in it. And I doubt seriously if you could put a ThyssenKrupp in northern Escambia County, or bring some of these potential automobile manufacturers into a coastal county in the state of Florida. Extremely difficult. So it's not all Pensacola, it's not all Escambia County, and we've got a lot of really good things going for us. If we could just get our attitude in line with our assets, I think we could improve things dramatically.
What do you think, in about 60 seconds, what do you think it's going to take to do that, get that attitude right?
Well, I think people have got to see some success. We've got to have some leadership at city and county level that are willing to take on the tough issues and do them efficiently and effectively. You can't drag out decisions like this Maritime Park for 3 years and have people feel good about it. We have to be able to respond quickly. We've got to use the best that our people have to offer in the way of brain power and talent, whether it's from the university or junior college or our city and county governance. We can do that, but we're going to have to bring it together, unify it, and give it an opportunity to pull together and be successful.
If people want to take a look at the survey, can they access it via the web?
Absolutely. Go to www.betterpensacola.org.
Okay.
And it's on there along with last year's survey. You can see both the 2008 and 2009 survey, do a little comparative look. There's also a place on there where people can put in their comments or make suggestions about future surveys. We'd welcome that.
Jerry Maygarden, it's been a real pleasure. Thanks for spending some time with us.
Well, my pleasure. Thank you.
Thank you so very much. Jerry Maygarden, he is the former House Majority Leader. Of course, he was former mayor of Pensacola, been involved in the healthcare industry for many, many years. Great pleasure having him on our program, and it's a great pleasure to have you spending some time with us. We certainly hope you'll join us again. Take very good care of yourself. I'm Jeff Weeks, and we'll see you next time on Conversations.